Welcome back to H360 Health Talk. We're here back with Gary Mulligan, the founder and CEO of Goals in Motion Physical Therapy and Wellness. Gary, thanks for joining me.
Thanks so much for having me, Dave.
How important is it? I would imagine you see people come in for 1 or 2 sessions. You mentioned the person that wants to get the exercises at home, that think that they can do it. Do you see a difference in medical outcomes from patients that follow their physical therapy almost to the letter versus those that are not in compliant?
Yeah, I mean, it all comes down to the mindset of the patient, right? So if you're coming in, and like I was saying before about not meshing, right? If you're coming in and you're saying, well, physical therapy doesn't work, whatever this guy tells me is not going to work, pretty much no matter what I do, it's probably not going to work for you. Right? Because there has to be some sort of a buy-in, right? There's placebo effect and there's nocebo effect. So, there's always these studies that come out with sugar pills and the placebo effect works. Same thing happens with movement. So if you're thinking that something you're going to do is going to hurt you, then you're going to have that nocebo effect where you don't want to go into that, or you expect pain with certain motions. So all of a sudden you're going to feel pain with that. The mind is extremely powerful.
Do you see a difference in male versus female? Can you size somebody up pretty quick and say, well, she's going to be really on top of it, I can tell, or he's going to be on top of it, versus somebody that walks in and you go, boy, it's going to take a little bit of work for me to convince them to, see this program out?
I wouldn't say that it's so much like a specific age or gender. I would say it's more, people come in and I can tell right away if they're giving me those excuses, right? And say, well, I'm really busy, I have to get the kids around, or, I'm at work all day, and there's always time to do stuff in between the day. And that's when I would say, like, well, maybe we should write down a journal and figure out what you're doing all day, right? Because most people are going to sleep 8 hours or less. Most people are going to be working 8 to 10 hours. That's going to leave about 8 hours for you to work with. So if we could figure out where those 8 hours are going, right, then we might be able to find a good 20 minutes for you to do some movement.
So part of the value that you're bringing to your new company is you're going to meet somebody where they want to meet. You're going to go to them. You're going to work around kind of their schedule. Is that part of your value proposition of this company?
Absolutely, because it's so easy to come up with excuses these days. Just this morning, right? I probably should have went to the gym, but I was playing with my son and it went to the wayside, right? So just helping people get rid of those excuses and giving them more chances to get things done. And really, if I'm coming to you, right, then the odds of you being compliant and really investing into your own rehab is going to be better.
And I think the key word is investment, right? It takes time, it takes commitment. It is an investment. But I mean, I look at, where I was when I came to you and what I can do now. I think it's a world of difference. My range of motion is back. My strength is continuing to build. So I think if you just stick with it, and I think a lot of it is managing your own expectations, right? As I mentioned, you get these type A personalities in there and they think, okay, in a week's time, I'm going to be back on the field or back, doing whatever I'm doing. And it's not that case. I mean, It's very seldom that you see something like that happen. Is there a body part that you can think of, whether it's a hip, a shoulder, a knee, an ankle, that has been more challenging than other body parts to kind of rehabilitate or get back on track?
I'm not sure about that. The thing with the low back pain is that a lot of people experience that throughout their life, and that it ends up being one of those things where there's always those stigmas, right? It'll be like, well, I had an MRI done and I have a herniated disc, but there's so many studies that show that, they could do an MRI of 10 people with no pain at all, and all of them could have herniated discs as well. It doesn't have to be the telltale. So when you have stuff like that, where there's that stigma of herniated discs and some sort of disability, right? Not saying that there aren't cases where it is, but I'm just saying that there's certain points where it actually gets over pursued, and people expect like that they're so much worse because they have this, where it doesn't have to be the case.
But isn't pain of the way that the body tells you that something's wrong, that something's going on here?
It could be, but it could also just be because if you haven't moved in that way, that your body, right, pain is actually, it's all nerve related. So pain comes from the brain, and it's telling your body that there's a threat with something. So if you haven't been able to move your arm all the way up overhead in 10 years, odds are that, if we're starting to get your arm close to that range, you might start to get some discomfort. And it could be related to weakness because you haven't been able to do that in so long. It could also be related just to the fact that you're moving in a position that your body hasn't experienced in a while, and you have to get used to that.
So, a lot of people these days, you go to a gym or you watch some of these video workouts. A lot of focus seems to be placed on the core strength. What exactly does that mean? I hear these words that you need to work the core today. We need to strengthen your core. What is that?
Yeah, so I mean, the core is actually much broader than it sounds, right? Everybody just expects abs. And it could be the abs, but it's your back muscles, your abs. There's the pelvic floor that's involved. And then part of the core wall, the roof, is the diaphragm. So people's breathing is involved in that as well. But then you add in muscles that attach up there. So your quads, actually, one of those muscles attaches into the hips. So that's going to be part of your core. The hamstrings attach to the back of the pelvis. So that's going to be part of your core, right? So then it becomes this whole encompassing thing where there's so many muscles that are involved with it. So you just have to find some sort of imbalance and try to work on that.
The other word I hear a lot of is this notion of mindfulness. And you kind of hit on it a little bit earlier about, we're working more hours than we're sleeping and working more hours than we're getting in family time. How does mindfulness play into the overall well-being of the mind and the body?
Yeah, I think it's a big part of it, and people's mindset in general is a big piece of it. If people come in, and the first thing I normally ask isn't how did you get hurt? It's what's going on? Tell me about yourself, right? Because I want to know where you're at. Some people come in and they'll tell me that they got hurt moving, but they forgot to tell me that they're moving because they lost their job and they have to downsize and all those other stresses that go on to it. So if you could get to the deeper root of that and help the person just to kind of like offload that, get that off your chest, tell me about it, and then we could come up with a little bit of a game plan and help you out with that. And that's a case where maybe, directing them towards somebody who could help them with meditation, which doesn't have to just be sitting in a room, dark room with, light sounds. It could be just breathing for 3 to 5 minutes after a stressful event. Maybe you get out of work, sit in your car, you go through some nice, slow, relaxed breathing. And that alone can help change your mindset and get you back on track to have a good day, as opposed to carrying that into the next part and you take that stress home with you.
Well, Gary, I don't have all that much familiarity with other physical therapists other than yourself, but certainly I think what we've talked about today encompasses who you are as not only a physical therapist, but as a person. And when either I can speak from experience, the way you dealt with me, the way that I've seen you deal with others, it's the whole body. It's I came in for a hip, but you worked on. You got to hear my stories about football and the Browns and my the many losing seasons. So if anybody needed mindfulness, it was me, and I think you provided that, and certainly did a good job on the physical end of working through my last 3 surgeries. So I know that Goals in Motion Physical Therapy and Wellness is going to be a huge success. I want to thank you for coming in today and sharing your story and your journey and your passion. And a little bit about your new company with us. So thank you very much.
Thanks so much for having me, Dave.